We are continuing our discussion on the coronavirus or COVID-19 pandemic, and with new case numbers declining throughout the country and here in Florida, many residents are questioning what we should do next. The CDC has issued new face mask recommendations for the fully vaccinated, and Orange County government has lifted all of its mandates. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our state medical professionals, and joining us is Alvina Chu, epidemiologist with the Florida Department of Health in Orange County. Alvina, thank you as always for being with us today.
Thank you for having me again. Thank you.
So Alvina, can you help to give us some clarity on the differences in the masking guidelines that vary between the CDC and the World Health Organization?
Sure. Well, we should remember the World Health Organization is a global organization, and they are providing recommendations for, the world. So they also have to take into account with this masking guidance that they have is that a lot of the world does not have access still to the vaccine, or they're having difficulty getting it. The CDC provides guidance for us in the United States, and we have ready access to the vaccine, hence one difference there.
And as far as the recommendations go, are they recommending, is the CDC recommending mask indoors only, and the World Health Organization doing something else, or what's the difference in the recommendations?
So really the CDC continues to recommend that those who are unvaccinated practice good pandemic precautions, which includes wearing of a mask, observing social distancing greater than 6 feet from others, and also practicing good hand hygiene at all times. And so those persons who are unvaccinated are at the greatest risk for infection from the SARS-CoV-2 virus, all of its variants, versus persons who are vaccinated. And so the vaccines that we have are very effective against preventing severe hospitalization and death, and also in preventing or minimizing the risk for acquiring the disease or spreading the disease if acquired. And so that's the difference in the recommendations are based upon the CDC's interpretation of the science that if you are fully vaccinated, you're at minimal risk for infection and for transmission.
And for those who are already vaccinated, does it look like we're going to need a booster vaccine in the next 6 to 12 months?
So I wouldn't put a time frame on it. There has always been this possibility that if the virus varies, or if there are mutations that affords the virus, any new virus that gains any additional adaptations or mutations to evade the antibodies that we've produced, there might be the possibility that we might need boosters in the future. I think it's unclear at this point, which is one of the reasons why we are really pushing to get people in the United States vaccinated, and really people in the world vaccinated right now while we have these effective vaccines available to us, is so that we can prevent or try to, as much as possible, not allow the virus to gain these adaptations that we've already gained any adaptations to evade the measures that we already have put in place.
And I know there's been some changes to a lot of the vaccine locations that are here in Orange County. Where can people get information about where the vaccination centers are?
So you're right. There's been a lot of changes because we've designed these mobile teams, or these strike teams, to get out into the community and really vaccinate those pockets of our community that remain unvaccinated, either because of a lack of easy access. And so the best place to go would be to the Orange County government website, ocfl.net, to find out where this week's locations will be. And so we move around to various communities all across the county to try to get our population vaccinated as much as possible.
And Alvina, we're hearing a lot about the Delta variant of COVID-19. Could you tell us a little bit about the variant and some of the cases that have started to pop up in Orange County?
Well, so far we've identified, since the beginning of our genetic surveillance, about 30 cases of this Delta variant. Within the last week, we've identified 12. We have seen over the past couple of weeks that there has been an increase in the proportion of the Delta variants for those sequences that we have identified. The predominant strain right now circulating in the United States is the Alpha variant. That's the B117 that was first identified in the UK. The CDC projects that soon, because of the Delta variant's high rate of infectiousness, it is easily transmissible, more easily transmissible, and more infectious than the other variants, that we may see very shortly, within the next several weeks, Delta could become the dominant variant circulating.
And because that Delta variant is more virulent, if you are already vaccinated, is there any greater risk to the efficacy of the vaccine? I'm asking for a friend.
So the virulence is unknown. Virulence meaning the severity. So is the Delta variant more severe than an infection with any other variants? So that part we're still getting information on. But as far as the infectiousness, yes, there have been some studies to show that the Delta variant may be up to 50% more infectious than the other variants. The vaccines that we have, there is some slight decrease in efficacy when the antibodies taken from persons who are vaccinated are challenged with the Delta variant, but still very effective at preventing severe hospitalization and death, and also very effective at reducing or minimizing the risk of infection itself and risk of transmission to others if infected. And so what we see with persons who might be positive or become infected after vaccination is very mild or asymptomatic infections.
How are we doing when it comes to vaccinating children 12 to 17?
So we've been working closely with our Orange County Public School system to have vaccination events available to all the children who are ages 12 to 17 to try to increase vaccines in that population. We've been hosting events at schools themselves, and we're hoping when school opens to be able to work with them to provide easy access to vaccines for children during the school year and throughout the school year so that we can improve the vaccine rates in that population.
Well, Alvina, thank you so much for being with us today and keeping us informed, as always, from the front lines of this pandemic. We really appreciate you.
Thank you so much. Thanks for having me.
We'll be right back with more. Stay with us. Let's continue our discussion with our local medical professionals. And joining me is Dr. Yolanda Martinez, manager of Orange County Health Services Department. And Dr. Martinez, we are so excited to have you with us today. And thank you for being with us.
Thank you. Thank you very much for inviting me. It's always a pleasure.
Dr. Martinez, can you give us an idea of how we're doing as a county fighting the coronavirus and basically how we're doing as far as our vaccination numbers, our trying to keep the numbers of infections down? What does that look like?
Well, we have been doing very good. We started very well with the vaccination efforts. Right now, we are at a 50% vaccination rate for the county. We would like to be higher than that for purposes of the herd immunity and to make sure everybody's safe. So 50% for 12 and older eligible for vaccinations is not terribly bad, but it could be better. So we're doing good there. And it could improve. Regarding the infections, we also had been doing very good. We had been able to control it, and it was below the 5%. However, over the last couple of weeks, it has been creeping up a little bit, the number of positive cases and the positivity rate as a whole for the county. So it has been increasing, which means that we have to remain vigilant. We have to remain active in our efforts to both promote and educate people about the benefits of the vaccination and getting the vaccine, and also maintaining, for those who are not vaccinated, maintaining some of the precaution protocols, like wearing a face mask when they're indoors or around crowds, social distancing. And for everybody, as always, the hygiene, washing the hands is always good for anything.
And of course, as you mentioned, the numbers are starting to creep up, the infection numbers.
Yes.
And of course, we're heading into the 4th of July weekend. And
Yes.
are you recommending that we go back to the way that we were for at least just a while, because there will be some social interaction indoors and outdoors, and start to wear our masks again, and start to really just go back to our basics that we know of infection prevention?
Well, going back to the basics is going to be a little difficult as a whole for a county, because we've been there already. And we know that not everybody was totally comfortable with wearing the masks. But like I said before, for those individuals that are not vaccinated, it's very important for them to take extra steps to protect themselves. And I was hearing in the news yesterday that even in areas where people are vaccinated, if the vaccine rate is not high, they're recommending even for those individuals to wear a mask. In our case here, I'm just making emphasis on those individuals that are not vaccinated to please use extra precaution, wear your mask, maintain social distance, and as always, wash your hands frequently.
And in your opinion, how do we go about reaching more people to get them vaccinated?
Well, we continue to provide information either through the various press conferences that we have, through our social media, internet, through these very important interviews that are provided through Orange TV, and the discussions that you have. I think also the word of mouth, individuals that have been vaccinated, that are vaccinated, that understand the value of the vaccine, talking to their friends and their relatives, especially those individuals that have not chosen to get vaccinated yet, and reaching out to them and explaining the benefit that being vaccinated, certainly most of all now with the Delta variant, provides a great level of protection. Most of the people that have been going to the hospital, and unfortunately the last death we had in the county was a result of the Delta variant, and individuals that are not vaccinated. So it's important to continue to spread that word and that information, that message.
And some of the county-sponsored COVID testing sites have closed. Where can people go now to get tested, or find out information about where they can go to get tested?
Well, certainly through their medical providers in the hospitals, but the county still has the site at Barnett Park that is open 7 days a week from 9 to 5, and provides the testing, both a rapid test, the PCR test, so any one of those, or both, for individuals who wish to have both tests. And in addition, we're providing vaccines there. We're providing the Pfizer and the Johnson & Johnson vaccine. So at Barnett Park, 7 days a week from 9 to 5, it's an all-inclusive service environment where you can get tested or get your vaccine.
For someone who's not sure about how to handle this upcoming holiday weekend, maybe they're going to family gatherings, not sure about inside or indoor or outdoor, what precautions, what things should they have at the top of their mind about how they should handle this upcoming very social weekend?
Yes, and certainly one to worry about, because I know everybody's been in their homes and wanting to have those social relationships again. I think we have to exercise social responsibility, and we've mentioned this before. And again, a vaccine, I know it's short notice for that, but if you have your vaccine, is not as important for you to be so cautious as if you don't have your vaccine. So if you're not vaccinated, again, and I know I repeat this several times, but it's for these individuals that this message is going out to, because they are the ones that are most at risk. And also, not only that, but we continue to have, if we're not able to reach that herd immunity, we will continue to have a problem in our community. So going back to your question, exercise caution, wear a mask if you're not vaccinated, maintain social distance, and try to take care of yourself and others as best you can.
Well, Dr. Martinez, thank you so much for being with us today and keeping us informed about our fight on this front with coronavirus. Thank you.
Thank you very much.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus, from local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve our community. And of course, we are also here to help you keep making those healthy connections. Stay safe, everyone.